invite you to stick around anyway and learn about a wonderful opportunity for you to participate in. We are going to be doing this session in 3 30-minute intervals, and what we'll do is Robin Axel Adams and I will speak for about 20 minutes about the program and leave 10 minutes for questions, and then we'll do it all over again. And we are excited that you're with us. My name is Brian Leland. I am the Fellowship Director over at the Fairbanks Center for Medical Ethics and a pediatric critical care physician at Riley, and I serve as the Medical Director for Peds Ethics at Riley Hospital for Children. And Robin, you are welcome to take it away and get things started.
Super, thank you. We're so excited that everyone's joining us. So I am Robin Axel Adams. I am the manager of the Fairbanks Center for Medical Ethics, and I am a past fellow. Was a fellow in 2011, 2012, and have been the manager since 2000 or for 6 years. And my background before that is that I was in chaplaincy. So today we really just want to give you a history and sort of the mission of the Fairbanks Center for Medical Ethics. We want you to sort of learn about what your fellowship experience would be like and what the application is like. And then we want you to be able to express to others and understand how your education can just impact your department, your hospital, and hopefully you as well. So a really quick history. We are founded in 2001 as a living memorial to Charles Warren Fairbanks. And so part of our commitment to them, to the endowment that they gave us, is that we would tell the story, Charles's story. And so if you don't know who Charles Warren Fairbanks was, you're not unusual, but many people do not. So he's a philanthropist, a US Senator, and he was a vice president to Theodore Roosevelt. And so if you know anything about your US history, Alaska was acquired in the United States during Roosevelt's time. And when Fairbanks went to Alaska to greet them as a new state, then they named Fairbanks, Alaska in honor and memory of him. And then he also became one of the first board of trustees of the Methodist Church. So the Fairbanks Foundation approached IU Health and asked for proposals of how they could create this living memorial to Charles Warren. And so Dr. Stephen Ivey wrote the proposal, and it was accepted. And so Dr. Paul Helpt was selected as the first director in 2004. And then he really worked to consolidate the programs within the Academic Health Center and then develop the fellowship. Excuse me. Our mission is to embed team members to be ethics resources throughout the healthcare system. And so in 2005, they had their first fellowship class. In 2019, we graduated our 100th fellow. And then this year we will graduate our 114th fellow. So kind of what is the Ethics Fellowship? It is 9 months long. We meet, you'll see the dates in a minute about when we meet. It is part-time, so we meet 1 day a week on Wednesdays. We are interdisciplinary, and we're interdisciplinary on purpose so that we have such a variety of people in the room and different perspectives. We have a class size that's intentionally small. 6 to 9 is our class size. And because we are endowed, there is no tuition expenses, and all materials are provided to you at no expense. So what is your commitment? Like I said, it is part-time, and so 1 day a week. You are there all day. We often start at 7:30 in the morning. We end by 4. This year, we'll be starting on August 25th, and we're going to end on May 18th. So you need to not just dedicate the time on Wednesdays, but you also need to have time during the week to prepare, because there's always readings to help prepare you for the sessions. You will be on call. The first call is an ethics consultant for 4 to 5 weeks, depending upon how many fellows we have. It just means that you will take the first call and take information, and then we provide support to you. And Brian's going to go into that a little bit more. And then you also need to make sure you allocate time for your scholarly project, which Brian will go into in a little bit. So Brian, I'm going to invite you to sort of take here for Amanda's statement.
Appreciate it, Robin. So I look forward to speaking with you about the details of the structure of the fellowship, but I thought we should start with a past fellow impact statement. And this is from Amanda Wilhelm, who is close to my heart, a nurse in the Riley Emergency Department, who was a fellow with us a couple years ago. And she says, I feel like I have better resources as a nurse handling challenging cases. I can navigate situations with a better understanding of ethical issues and provide help to others around me, which essentially summarizes exactly what we identify as our mission, which is to embed ethics resources. Robin, could we? Oh, perfect. Sorry, I thought that was the previous slide. So let's talk about the specifics of the fellowship. I break the fellowship down into 3 primary components: a didactic education component, a service component, and then a scholarly activity component. Speaking of the education component, we have a very detailed curriculum at this point, and we break it down into foundational ethics principles, which will start with bioethics and some of the historical content for the foundation of this discipline in general. And then we'll work through the course of the fellowship through various clinical ethics issues that should be pertinent to many, if not all, of our fellows as they are involved in the greater healthcare system. And this could include everything from perinatal and neonatal ethics to transgender ethics to ethics surrounding the care of undocumented immigrants. And the list goes on and on. And these are approximately 2.5 or 3 hour seminars where a content expert, either within our center or an invited expert, will come and facilitate a discussion for our fellows. The second component of our educational curriculum is a communication component. And this is a very important aspect as part of the endpoint training, is that you are equipped to participate in difficult conversations. And we are so fortunate to have Dr. Lucia Boschel on staff with us, and she leads our fellows through something called Vital Talk, which is essentially a boot camp on how to navigate challenging conversations in stressful circumstances. And there are some other components to the communication curriculum as well that fellows are able to be exposed to. And then the third component of the education focuses on cultural competency. And this allows our fellows to appreciate the nuances and particulars of how various faith groups and cultures experience and interact with our healthcare system. These seminars, as I mentioned, are two to 3 hours, are either led by one of our Fairbanks Center for Medical Ethics content experts who are core faculty, or an invited external expert. And I would say it's probably 65-35 core faculty and invited experts. For each of these seminars, there is scholarly reading in order to prepare for these discussions. For the entire day, fellows should expect to have something approaching 6 or 8, occasionally 10 articles per week in order to be able to participate meaningfully in their discussions for that fellowship week. So as Robin mentioned before, there is a need for fellows to be able to prioritize and accommodate some time outside of the fellowship in order to prepare, as those seminars can't be fruitful without adequate preparation. The second component is the service component, and this focuses on clinical ethics consultation. And IU Health has an ethics consult subcommittee, and that committee meets on the second and fourth Wednesdays of every month. And during the fellowship period, we have our fellows attend those meetings, and in fact, actually present at the meetings the cases that are being discussed or navigated. This is the second and fourth Wednesdays of each month, starting at 7:30. Fellows additionally, for approximately a month, give or take a few days during their fellowship experience, will be first call for ethics consultation, which means that they will carry what used to be a pager is now a phone, and get texts about ethics consult requests. We function just like any other consult service, and those requests will be fielded, and then fellows will be mentored through completing those ethics consult, whether that be participating in a care conference, or providing an ethical framework for decision making for a medical team, or empowering or supporting members of a respective family of a patient, or members of the medical team as well. We here in the last couple of years have really added attention to a new component of the service portion of our fellowship, which is competency and ethics note writing. Fellows come to learn pretty quickly that an ethics note is a very unique piece of information in the medical chart, and as such requires practice and education on how to go about doing that in a reasonable and efficient way. And so we have put in a curriculum so that fellows have a very regimented approach to learning that process, and then have a level of competency come the end of the fellowship in order that they would be able to write ethics consult notes in their respective role if they were to join the infrastructure of their ethics teams at their respective hospitals. Next slide, please. Thank you. The third and final component of the fellowship is our scholarly activity. This is oftentimes the most intimidating component of the fellowship, at least initially, but also the most fruitful. And that is that we encourage and frankly insist on each of our fellows moving through an independent scholarly activity. And the good news is that we don't assign that project to our fellows, but rather empower them to identify an area of interest pertinent to ethics in their respective discipline and help them achieve success in investigating it. And this can be anything from a formalized research project to development of hospital policy or of a grand rounds presentation to promote awareness of an important topic to a quality improvement project, among others. Each of our fellows early in the fellowship, after they do something called the project idea formulation session, is assigned one of our FCME faculty as their primary mentor to help facilitate their success during this fellowship period. This is probably the part of the fellowship that requires, pardon me, the most dedication outside of the specific structured fellowship activities on Wednesdays. And so we expect our fellows to be able to find time to do literature reviews and investigate the research and spend time writing as well. Thanks, Robin, for going back. Next slide. So a couple examples of past fellows projects for you to take a peek at. So Sherry Bate, who is a respiratory therapy manager for IU Health, did a project where she resurveyed other respiratory therapists about their experience and perceptions surrounding involvement in care planning for patients who were going to have compassionate discontinuation of life-sustaining therapy. And that was a really fruitful project. Another example being a literature review that Dr. Kristen Emile did. She was a PEDS pulmonary fellow at the time, and she was looking at the shared decision-making model in approaching decisions related to whether or not to move forward with a tracheostomy and chronic mechanical ventilation for pediatric patients. There are a couple others here that you can see. Melissa Young, a nurse practitioner in our urology clinic here at Riley, did a poster presentation about the importance and need for urology and pediatrics to step up to the plate and be responsible and take ownership of sexual abuse screening. Next slide, please. So I mentioned to you the project idea formulation session. I think one of the things that helps reassure our fellows is that we have a very organized approach to moving fellows through their scholarly project. And we call these milestones, if you will, where we help facilitate a fellow taking an interest and turning that into a feasible project. That's when they formulate their idea and then move through steps necessary to empower them to have success. And that includes completing an annotated bibliography, working on literature review, and then a final product. Something that we have at predetermined periods throughout the fellowship are called WIPs, or works in progress sessions. And those are opportunities for each of the fellows to come to the group and say, here is where I am with my project. These are the roadblocks that I'm coming across. This is the feedback that I want. Here's the survey that I intend to submit. Can I get feedback on that? And then everything culminates in a final presentation at the end of the fellowship period. Of note, fellows are not expected to publish, but many do. And as the previous slide mentioned, I think here in the past few years, we've had approximately 33 published papers come from fellows. I also want to put a little plug in for the carrot that we dangle for our fellows, which is an opportunity to apply for a scholarship that FCME will fund if you are interested in having your project presented at a national conference and you're accepted. We're in a position to potentially fund your participation and attendance at that conference. In the continental United States, I always have to clarify, Hawaii is off limits due to funding limitations. So hashtag COVID, I'm sure that there are questions about, like, well, what does this look like in the current era? Is this an in-person fellowship? Is this all virtual? And the short answer is it's going to depend, which will become your favorite statement as a future ethicist. but we prefer to be in person, and that would be our ultimate goal. However, we have each of the past 2 fellowship years found ourselves in a position where we've had to move the fellowship to an all virtual platform. The one thing we will not be doing is a hybrid setup where it is come if you want or be virtual. If we have the ability to be in person, we feel strongly that the educational productivity is just that much higher, being able to appreciate body language in particular as we talk about some of the things surrounding communication, et cetera. So we are very aware of the constraints, and we are equipped to navigate through them, and we will do what is necessary in order to show an abundance of caution and make sure everyone is safe. Take it away, Robin.
Thank you. We also have the advantage of working with infection prevention. And so when we did start off this year in the fall, in-person infection prevention came and helped guide us in the best way to make us all safe. So we work very closely with all the resources that we have at IU Health. So just another impact statement, because we can share with you all the information, but hearing from students, I think, is really important. And so Sarah is a social worker at University Hospital, and she says, the social work team at University Hospital I work with has begun using me as a resource to process a particular situation merits an ethics consult. We have been able to successfully navigate several consults during the past few months. And so Sarah is a great resource to them. And again, another echo of the fact that people know that they can come to you and ask for help through navigating particular situations. So I know that you were so excited. You're just getting excited and you want to know, can I apply? And we want to say yes. And so what we're going to do now is kind of walk through how you can apply. So in order to prepare yourself for the application, you're going to need to have either your CV or your resume. There are 4 personal statement essays that we're going to ask that you write. We're going to then ask for 2 letters of recommendation. The first letter of recommendation really needs to be from someone who can just talk about your skills, about being a learner, how you are about thinking through things, how you are about contributing, just what does it mean for you to be a fellow, and how do they see you in that role? You know, as Brian mentioned earlier, our sessions really are seminar style. And so we only get as much out of them as people put into them. And so we want to hear your voice. And so we want to have people who are going to contribute, not just people who are going to be bumps on the log. So we want to hear people talk about your ability to be kind of a part of a group. And then we also would like a letter of support from your supervisor, because this is for protection for you and for us. And that letter needs to say that they do know that you will be gone for this every Wednesday, and then the dates. And then that way, if in the middle of the fellowship, your supervisor all of a sudden starts scheduling on you on Wednesdays, you can come back and say, hey, look, you know, you did have this letter where you agreed to let me off. So we just ask for that letter of support. Our application process is online only. You can access it through our website, excuse me, which I'm going to show you in just a minute. We review those applications, and then we select who we will interview. And then the FCME faculty work together to interview people. You will be interviewed in a group format, and then you will be interviewed individually. And the fact that it's 2-on-1, 2 FCME faculty to 1 applicant. It is competitive. As we said earlier, there are 6 to 9 slots. And so there is no guarantee of acceptance, but we are really excited for everybody who does apply. So let's really quickly look at, we want to make sure you have time to ask questions. And so here is our website if you have not been to it yet. This is the cover of our website. No, I did not click to our website. I clicked the next slide. I have little faith in myself and technology, so I put that slide in there just in case, but look, it worked. Okay, so here's our website. And then you're going to scroll on down to where it says Fairbanks Fellowship in Clinical Ethics. And when you click on that, it will pull up sort of a description of who we are and what it is. You're going to see those 3 tabs that Brian just talked about. So if you want to delve into that a little bit more, you can. If you keep scrolling down, you're going to have soon a video of one of the presentations that we do today. This is last year's presentation, but within the next week, this year's presentation will be up. So if you want to look at it again, or if you want to refer someone, you just go here. Here is a 4 manager sheet, which I will get to in just a second. So you keep scrolling down. And right here is the application. So you're going to do click here for application, and then that will take you to the application. This is just some information about when the applications are due. let me back up here for a second and know that I'm going to talk about this in a minute, but here is the site. When I said, remember when I said the website and the 4 managers, this is what I'm talking about here. All right. So our applications are now open, and they are going to be due on Monday, April 19th by 5 p.m. And then we will be offering interviews no later than April 23rd is when you will be hearing from us, whether you have an interview or not. And then these are the 3 dates that we have blocked aside for our interviews. If they do not work, we are able to be flexible, but they need to be work-related excuses. We know sometimes floor nurses do not have always the same opportunities for flexibility, for example. And then by June 1st, you will hear from us about your acceptance or your rejection. Sometimes managers want to understand and know what they're allowing their person to be released from work for an entire 9-month period for 1 day a week, because we know that that's a lot for the managers and for your fellow team members as well. So if you would like to be able to share with your managers just a basic information sheet, that place that I mentioned on the website that I said I'll come back to, here it is. So you can click on that button, and this this PDF that is here on the left comes up as a PDF that you can print off and that you can then give to your manager. And that hopefully will answer some of their questions. If they have any more questions, it gives them Dr. Leland's information. They are also able to directly submit their letter for your application. And so I don't have it on this particular PDF, but on the website, you will see that there is the link that they can go to. And so if they would like to submit their letter directly, then we have that for them. You can also invite them to watch this website or to watch this this presentation if they would like to. So just remember that, when Brian, why don't you want to go ahead and kind of take this and round us on off to just finish us up about the benefits of the fellowship?
Sure, be happy to do that. Thanks, Robin. So I think, one of the things that you may be discussing with the respective manager or program director is, what's in it for me, they may say. And the short answer is a lot. There is much to be said about the ability to help colleagues navigate ethically challenging situations. And we feel quite confident that fellows who complete the fellowship with a certificate are able to do exactly that. And in particular, in the current social climate with concerns about an acknowledgement of racial disparities, and in the COVID pandemic, moral distress is at an all-time high. We spend a lot of time focusing on that, and Dr. Voschel is a world expert on moral distress and how to help support those who are experiencing it. And the additional piece is that if you want to continue to be a part of the ethics infrastructure here at IU Health or at your respective institution that you're coming from, the opportunities are certainly available after the fellowship, because you'll have a skill set that makes you unique and desirable as a result.
So I am aware of the time, and I know that we are going to repeat this in about 8 minutes, but I want to allow people some time for questions. So I will, our impact statement is there, and I'm not going to read it, but I will put this up to just let you know that you feel free to unmute yourself and ask your question. And I will say that at noon, we will start this again. So if we don't get to your question, please feel free to reach out to Annie or myself, or stick around for another session, but you don't have to at all. So go ahead and unmute yourself and ask away.
We'd love to see your face as well. So if you would both turn your camera on and unmute yourself if you want to reach out, that would be awesome.
Hey, so I'm Scott. I wanted to ask a question about, so right now I'm a resident chaplain and that ends in August, right? Which means that it's a temporary 1-year position. How would I go about navigating getting a manager to sign off for a year when I might be in Ohio, right? Or wherever, right? For that 1 day a week thing. That's kind of my real question.
Yeah, Scott, I apologize if you and I have already talked. Have you and I already talked at a different time?
We did at the end of November, early December.
Perfect. Yeah. Brian, so you do know about the 2nd-year residency. So that's an option for you.
Yep.
IU Health has a 2nd-year residency, a fellowship specifically for chaplains. Brian, you want to kind of address like how he would navigate the,
Yeah, I mean, the short answer, Scott, is that would be really challenging because we would hesitate to definitively reserve a fellowship position for someone who isn't able to commit to being a part of the fellowship. And if you are, for example, say in Ohio, and we're doing in-person fellowship activities, then unless you have a flying car, it seems unlikely that you'd be able to meet the contracted or agreed upon expectations for participation. But obviously we want to do everything we can to try to help facilitate that as a possibility. So what I would say is, why don't we take that conversation offline, and you can shoot Robin and myself an email, and we'll see what we can do to try to firm up and clarify what the options are with you, okay?
Yeah, no, I appreciate that.
Absolutely, and appreciate you bringing that up. Don't be shy now.
Hi, I'm Tamara.
Hey, Tamara.
With the project, is that with the presentation at the end, is that in like a group setting? Is that in front of just you guys? What does that look like?
Yeah, so the answer is that it is a group setting. So you would be presenting to the core faculty. Occasionally, fellows have a secondary mentor who is outside of the Fairbanks Center for Medical Ethics. So that person would obviously be invited, and then to your fellow fellows. It previously was a more informal discussion, and here in the past few years, we've formalized that to give our fellows an opportunity to essentially have a practice run if as many of them look to present it in an even more formal setting, like a national conference or a grand rounds or something like that.
Gotcha.
I will say that some of our fellows, I can think of a couple, have eventually become, and their projects have eventually become our monthly ethics lectures. But that's not, we don't guarantee that, nor do we expect it. So because honestly, at 9 months, your fellowship project is not 100% done yet. And so we want to set you up for success in the best way that you can be prepared to present it in a much more public manner.
Okay.
And it may be done, but many people are 90% of the way there, but waiting on, let's say, a reviewer from a journal or something like that.
Okay.
Yeah, great question. Thanks.
Hello.
Hi.
Lee Danchik with IU Health, resident chaplain this year here. Do you have any recommendations for preparatory reading materials, either in advance of making an application, or particularly if we were offered a position before we would actually start the fellowship, to just kind of familiarize ourselves and get even deeper within the field of biomedical ethics?
That's a great question. It's one that has not come up before. We certainly don't have assigned reading for fellows prior to the fellowship session. We feel that the amount of reading that we ask of you is robust enough, but it's something that I don't think we would hesitate to put together hey, this is interesting and potentially useful foundational information for you. And I think Robin and I could generate a very brief list, but I will tell you that I don't want you to think you need to do a bunch in order to meaningfully participate, but rather if you complete the readings that are assigned, you will have everything that you need at your fingertips.
Yeah, Michael, I'm aware of the time, so I may end up saying, let's finish this conversation offline, because I'd love to talk to you about that. But one of the things that I think, what I know is to be true, is that if you have a basic, this is not like hospital 101, like you really do have to understand the clinic setting, but it is that we start off very slow in ethics. And so we start off with a session of what is bioethics? What are the foundational principles like Brian was talking about? And so if there are times, even as a chaplain, that sometimes I would get lost in the medical language, and you just sort of say, hey guys, I don't know what that disease is. And then we explain it. But because we are teaching, we're teaching each other. Just like people would say, Robin, tell me about chaplaincy. So I'm going to be aware of the time that we're going to start all over, but Michael, if you have more questions about that, I'm with you guys tomorrow, or no, later today. So we can talk later today.
Sounds good. Thank you, Robin.
Yep.
So we will get started here in just 1 second. I think we probably have time for exactly one more question from the previous group, if there's anyone that needs to go about their business and was hoping to get one last query in. Okay. Well, thanks to everyone who was with us this past half hour, and we'll get started again here.
No, sorry, that was me. I'm going to stop the recording for just a second, and then so we can restart from the beginning.
Great.